autosomal recessive, you need both copies to be abnormal. And they found the gene, and there's work going on now to try to see if they can couple it to a virus particle and then inject the genes, this virus particle that's coupled to the gene, under the retina in one eye, and see if they can get the gene to sort of go into the parent cell and prevent the disease from progressing. In an autosomal recessive disease, the problem is that you don't have any of the good stuff. It's not that the gene is causing harm, it's that you don't have enough of the normal product. So if you can get the normal product in, you can do a clinical trial. So they're started for there's a type of dog that actually exists in nature. It's not a laboratory creation, that gets a severe retinal degeneration similar to retinitis pigmentosa, and they found that the gene that's abnormal in those dogs is the same one that's abnormal in a very severe retinal degeneration that starts right from birth. And so about 8 years ago, they did this kind of gene therapy in dogs. In other words, for one eye of the dog, they took the normal gene, attached it to a virus particle, which allows it to get into the cell and incorporate the genetic material, and the other eye they left alone, and they watched as the dogs grew. And as the dogs grew, the eye, if they closed the eye that was treated, the dog was banging into everything. But if they had the other eye open, the dog seemed to see normally. And if you did electrophysiological testing, that eye was not degenerating. And it's about 8 years since that was done, and the effect has continued. In other words, there was some question, will the gene somehow detach itself and slough off or whatever? But it's still going on, and it's still working well. And a few months back was the first report of treating about 9 patients who had this same gene abnormality, who were people in their 20s and 30s, I think, and they showed that they can get the gene to get in, and they can, and in some people, these people had very severe disease, but there was a suggestion maybe they're seeing better, and now they're actually starting a clinical trial where they're going to start testing children and enrolling children in this study with the hope that they can prevent damage down the road. There are plenty of seats up here, everyone. So anyway, it's a long-winded description, but in Stargardt disease, which is one of the most common hereditary degenerative disorders, you get, it's a one-gene abnormality, and if you could replace that gene, theoretically you could prevent the progression of disease and preserve vision. And that is really close to becoming a reality. I mean, there's some studies on animals now seeing if the gene can get into the correct cell, and as soon as that goes ahead, people are poised. There's even there's a company, Oxford something, that they have, it's called StarGen. It's genetic therapy for Stargardt. They're basically ready to implement it as soon as it's proven safe and as soon as all the technological things are done. The problem is that we don't know how to follow Stargardt's disease. How are you going to know? Because obviously people are going to start treating cases where they've already lost a significant amount of vision, and you want to measure sort of slow effects or small effects. And how do you do that? And it's difficult because, as I'll show you, in Stargardt disease, by looking at the abnormality, you cannot tell where the person can see or not see. So it's going to have to be something like microperimetry that will be used. The thing is that there has to be some adaptation of software so that you can test what you want, and in a way that can be reproduced over time.